Hello, everyone. We're here today with GU Oncology Now with the ASCO Bladder roundtable discussion. My name is Vadim Koshkin. I'm a GU medical oncologist at the University of California, San Francisco, where I help co-lead the bladder cancer program for the medical oncology side. And we have a great panel with us here today, and I'll let the panelists introduce themselves, starting with Matt.
Hi, I'm Matt Zibelman. I'm an associate professor of GU Medical Oncology at Fox Chase Cancer Center in Philadelphia and director of clinical research of the GU service line.
Hello, my name is Cora Sternberg, and I'm a genitourinary oncologist and professor of medicine at Weill Cornell Medicine. I'm also the clinical director of the Englander Institute for Precision Medicine at Weill Cornell. Happy to be here.
Hi, I'm Dr. Dan Petrylak. I'm professor of medicine and urology at the Smilow Cancer Center, Yale University, and happy to be here as well.
Great. Well, again, a wonderful panel here, and our topic here today is really the treatment strategies for advanced bladder cancer. As you mentioned, bladder cancer is certainly not where lung cancer is in terms of being able to, target different drivers. We have maybe, at least one now with the positive phase 3 trial of erdafitinib. So do you see us as moving in that direction where we will maybe be able to individualize treatment more? Also with, availability of maybe now other drugs, maybe targeting HER2, for instance.
I think that's where I was going to go with that. And yes, I think that is certainly the next group that I think there's excitement for, and we appear to have good antibody drug conjugates targeting HER2, where we've had failures with prior HER2 targeted drugs in the past. And so I do think we're better with designing the antibody drug conjugates and understanding how they work, which is important. And I do think we're seeing that HER2 does seem to be a viable target, and I do think we'll have that another group of patients. I think how to separate these HER2 targeted antibody drug conjugates with enfortumab vedotin and some of the others is going to be an interesting challenge going forward. But I think we're getting there slowly, but we're getting there.
Look at drugs like in HER2 that work even in patients with breast cancer that are only one positive. I mean, those are the ones, I think those are the kind of drugs we need to be studying in urothelial cancer.
Yeah, and there's even now, some data in urothelial for HER2 targeting antibody drug conjugates for low HER2 expressors, also from the, right.
It's interesting when Maha Hussein published data a number of years ago with Carbogem and paclitaxel along with Herceptin. When you look at that study, it was disappointing because the median survival was only 15 months. But HER2 marks for a poor prognosis group of patients in that particular trial. And these were patients predominantly with visceral metastases, so you wonder whether that was diluted out in the beginning by the patient population that was selected.
Selected by immunohistochemistry also.
Right. It was IHC, it was also by serum. It was a lot of different, it was any method of positivity was what was used. So certainly I think that's interesting.